I'm Stephanie from Onward Philly, and I'm here today to show you a few mobility assessments to screen for your overhead position, which can be beneficial in gymnasts as we have to be in that overhead position while we're hitting all of our handstand positions, whether it's tumbling on floor or swinging on bars. You will need a surface to lean your back against, a stick, and then you can either use a block or stack up some panel mats for the other test that I'm going to show you. So, for test number 1, we're seeing if we have the soft tissue mobility in our shoulders. You will sit cross-legged, so that way we're locking that low back. We're going to take our stick, and we're going to grab shoulder width apart. You're going to keep your back nice and flat against the wall, and from here, you're going to raise overhead. And you should be able to touch the wall behind you. But be careful, you want to make sure that there aren't any compensations for this movement. So what you might see is that if we are limited to here, someone might cause that arch in the low back to try to touch the wall. So make sure that the ribs are tucked down, spine is nice and neutral, and that you can touch the wall, maintaining that position. If not, there's probably a soft tissue mobility restriction for your overhead position, but if you did pass, then we're gonna move on to step 2. We're gonna use the block of panel mats that you have or a table, and you're gonna lie on your stomach. So this test will see if you have the strength to attain that overhead position now that we've established that you do in fact have the overhead position. Lying on your stomach, arm will be hanging off, and you're trying to get bicep to ear. Things to be careful of, just making sure that you're not tilting the torso one way or another. We want to keep this nice and strict, and being able to attain that nice straight line from wrist to ankles. If you found it difficult to do one of these 2 tests, then follow up with our mobility video so that way you can tackle your overhead position.